Conferees. Good morning. We're going to bring the meeting to order a little bit late, but anyway, committee, thank you for coming today. Staff, thank you so much for being here also. And conferees, thank you for being here too. We're going to go ahead and open the hearing on Senate Bill 82. Carly.
Thank you, Mr. Chair. Good afternoon, committee. This is going to sound very familiar because Senate Bill 82 is a mirror of House Bill 2249. It requires the Secretary for Aging and Disability Services to grant physical environmental waivers for certain rural emergency hospitals to provide skilled nursing facility care. It creates a new section of law that would require the Secretary for Aging and Disability Services to grant physical environment waivers for existing nursing facilities to an applying rural emergency hospital to transition up to 10 swing beds into skilled nursing facility beds if the facility, 1, is currently licensed as a rural emergency hospital, 2, was licensed as a hospital immediately prior to its designation as a rural emergency hospital, and 3, during the facility's licensure as a hospital, the facility provided skilled nursing facility services or critical access hospital swing bed services for at least 1 year without a finding of immediate jeopardy. The bill passed the Senate 40-0 and would go into effect on July 1st, 2025 upon publication in the statute book.
Committee questions of Carly. Seeing none, thank you very much. First proponent we have is Tara Mays, Hospital Association. Tara, welcome to committee.
Good afternoon, Mr. Chairman and members of the committee. I am Tara Mays with the Kansas Hospital Association. Appreciate the opportunity to appear before you this afternoon in support of Senate Bill 82. As Revisor Carly mentioned, this bill is a mirror of House Bill 2249. It has previously passed the Senate on the 19th of February on a vote of 40-0. It has already passed this committee and passed the House on a vote of 122-0. This bill really gets at allowing a rural emergency hospital to get past one important step in being able to keep and retain skilled nursing facility beds. And with that, Mr. Chairman, I won't take up much more of the committee's time. I would be happy to stand for questions. And if I may, Mr. Chairman, wish those of you on the committee celebrating special days a happy birthday as well.
And who would that be?
I believe there's a representative from the Johnson County area on your committee celebrating today.
Thank you for being discreet. Very good. Well, we'll have to sing you happy birthday here in a little bit.
Happy birthday.
Happy birthday to you. Happy birthday, dear Angela. Hey, to you. Thank you. All right. Thank you for saying that, telling us, because she was trying to keep it a secret.
Absolutely. Happy to stand for questions, Mr. Chairman.
All right, and thank you for your interest in the time today, because we are, and this week we do have a lot to do this week. Okay, next we have Kylie. Kylie, welcome to committee.
Good afternoon, Chairman Carpenter and members of the committee. My name is Kylie Childs, Director of Government Affairs with Leading Age Kansas, and thank you for the opportunity to provide proponent testimony on Senate Bill 82. Like Tara said, we just want to reiterate the support that this bill already received and passed out of this committee on the House bill side. Additionally, we wanted to hone in on a few points that part of an adequate healthcare continuum for aging Kansas is to ensure there are not only long-term care nursing facility services, but shorter-term skilled nursing services as well. So we just want to reiterate a few points that Mercy Hospital was already providing skilled nursing services to their community just under the KDHE hospital license, and that building was good enough to provide those services for the last 54 years. So we believe this bill would not compromise any quality of care along those lines. Additionally, the bill only states a physical environment waiver will be granted for qualifying providers, but they would still be subject to the additional regulations of licensing as an adult care home. And currently, nursing homes already receive this physical environment waiver because a lot of our providers have been around for years and new construction can be costly. So this waiver is not something outside the realm of normal operations for KDADs to grant. And this bill limits in scope who the waiver would apply to, being those critical access hospitals with established services, skilled nursing services transitioning to these REH models. So again, often those serving in critically needed rural areas. We cannot afford to lose any more beds, and so that's why we stand in strong support of this bill. I'll stand for questions at the appropriate time.
Committee questions. And I rushed Tara off before I asked for committee questions from her too, but never mind. Okay, very good. Thank you, Kylie. Next, we have Lacey Hunter as a neutral. Lacey, welcome to committee.
Thank you, Chair, members of the committee. I am Lacey Hunter. I am the Commissioner of Survey and Certification for the Kansas Department of Aging and Disability Services. Thank you for the opportunity to provide testimony on Senate Bill 82. Senate Bill 82 adds a section to the Rural Emergency Hospital Act that would require the Secretary of the Department of Aging and Disability Services to provide a waiver to physical environment standards to any rural emergency hospital that meets the criteria described in the bill, allowing them to transition up to 10 beds from swing beds to skilled nursing facility beds. To receive the waiver to physical environment standards, eligible hospitals must be a registered rural emergency hospital and have been a registered hospital before becoming a registered rural emergency hospital. Eligible hospitals must also have previously provided skilled nursing level of care or identified swing beds. Senate Bill 82 would have little physical impact on KDADS and clarify in statute KDAD's authority and responsibility to provide waivers to statute or regulatory requirements. KDADS is aware of only one rural emergency hospital that meets the criteria to request a physical environment waiver. Senate Bill 82 would only impact providers if the Centers for Medicare and Medicaid Services does not approve this newly created entity to be certified to provide Title 18 and Title 19 services. KDADS did not have any regulatory oversight over the facility that would qualify for a waiver under Senate Bill 82 and does not have information on the utilization of the long-term beds in the facility before its transition to rural emergency hospital. Granting the waiver from the physical environment standards for the facility meet the requirements of Senate Bill 82 could allow the provider to continue providing long-term care services as it did before the transition from a critical access hospital to a rural emergency hospital. This would only be true if CMS approves. Thank you for the opportunity to provide testimony. I'll stand for questions at the appropriate time.
Very good. Thank you, Lacey. Committee questions of Lacey. Seeing none, thank you very much. Committee, I'll bring your attention to written-only neutral testimony from Jerry Smith, Director of the Bureau of Facilities and Licensing, Kansas Department of Health and Environment. Okay, with that, we'll close the hearing on Senate Bill 82. We will open the hearing on Senate Bill 88. Carly?
Thank you, Mr. Chair. Committee, Senate Bill 88 requires the state long-term care ombudsman and regional ombudsman to receive training in memory care. Section 1 amends KSA 75-7306, which is the statute setting out the powers and duties of the state long-term care ombudsman in subsection F by adding to the training program that the long-term care ombudsman is required to prescribe and provide. This bill adds required training on the rights and needs of long-term care residents who have dementia and strategies to care for these individuals. This training shall include 1, understanding the warning signs of this condition, 2, knowledge of person-centered dementia care, 3, effective communication with such residents, 4, recognizing behavioral symptoms and alternatives to restraints, 5, addressing specific threats to resident safety, 6, referring to resident support systems to accurate and up-to-date information, and 7, protocols for connecting individuals living with dementia to local care resources and skilled dementia care professionals. The bill passed the Senate on a vote of 40-0, and it would go into effect on July 1st, 2025, upon publication in the statute book.
Very good. Thank you, Carly. Committee questions? Seeing none. Very good. Thank you. First proponent we have is Jamie Gideon. Jamie, welcome to committee.
Good afternoon. Thank you, Chair. Chair Carpenter and members of the House Health and Human Services Committee for allowing me the opportunity to testify in support of SB 88. My name is Jamie Gideon. I'm the Kansas Director of Public Policy for the Alzheimer's Association. One of the purposes of this bill is that we're trying to address the gaps in training that are brought about when a new ombudsman is appointed by the governor. So we've seen that in the past, that there's a new ombudsman appointed, and the ombudsmen are trained with different types of topics. And the topics included in this particular bill, which they've mentioned, are very basic, but they're very essential. They're the same topics that are in the basic dementia training that the Alzheimer's Association provides to ombudsmen across the country. These topics provide a good foundation for their work with residents in long-term care and their families. In addition, there's no cost for this training. Organizations like the Alzheimer's Association and other organizations, including the state agency ks, have agreed to provide this training for free. It has also been mentioned in previous testimony that the ACL, which is the Administration for Community Living, already requires this training, so it isn't needed. But in fact, according to the Long-Term Care Ombudsman Program Training Standards published by the ACL, curriculum content must include, but not limited to, the following subject matter knowledge: introduction to common health issues individuals using long-term services and supports may experience. Alzheimer's disease and related dementia is one of those health issues listed, but there's no required dementia-specific topics, meaning they could just walk into a room with their training and say Alzheimer's and walk out, and they would fulfill their obligation. There would be no other mention of Alzheimer's, and they would be fine. It is important to do everything we can to protect the most vulnerable in our community, and those living with Alzheimer's are among those that should be protected. I will stand to questions at the appropriate time.
Very good. Committee questions? Seeing none. Oh, Representative Orpeza.
Thank you, Mr. Chair. Thank you for your presentation, Ms. Gideon. My question is how much time does this training take?
Sure, it takes about, the Alzheimer's Association one takes about an hour and a half online. They can also come out to the Ombudsman office and present too, but it's about an hour and a half. It's not very long.
Okay, thank you. Thank you, Mr. Chair.
Committee, further questions? Representative Steens.
Thank you, Mr. Chair. Just to follow up, do they do ongoing training? Because an hour and a half really doesn't seem like a long time, sorry, but I'm thinking even the caregivers in there, there's a lot of people that don't have a lot of training for Alzheimer's, and there's definitely a lot to cover.
There is ongoing training provided as well, that option that we do have. That's once the training, the hour and a half one is done, there's an option to sign up for ongoing training each year.
Thank you.
Mm-hmm.
Committee, further questions? Seeing none, thank you very much for being here, Jamie.
Thank you.
Next, we have Haley Orndor. Haley, no stranger to this committee, I'm sure.
Maybe to a few new faces. So, hi, thank you, Representative Carpenter and members of the committee. My name is Haley Ordoin, and I am who we are talking about here. I am the State Long-Term Care Ombudsman, recently appointed this last July, and I, along with my 11 ombudsmen that are regional and special projects, are who this bill is regarding. One thing I want to make clear, a lot of people don't understand what an ombudsman is and what we are not. We do not provide direct care. We are not the providers of anything. In fact, in a facility, if we are going and visiting with someone, we can't even push a resident in a wheelchair if they ask, like down the hall. We are strictly there to advocate for resident rights and make sure that they are being followed. I have included that in my testimony. If you care to look, supplemental information provided, your rights as a resident, goes into further detail of what we do and do not do. We are obviously supportive of Alzheimer's and dementia education. It is a current requirement already. Jamie mentioned our ACL guidance. So the ACL is who oversees our training, and that is by the direction of federal HHS. So we're a federal oversight. But within that, there is, as she stated, and as we have stated in our testimony, I highlighted for your quick reference, different things that we're already required to do that is in some of this bill language. So we are already required to have Alzheimer's and dementia training. We are already required to understand different communication patterns, different communication types, verbal, nonverbal, Alzheimer's disease-related dementia, myths and stereotypes, understanding living in the long-term care setting, understanding their resident rights, person-centered care, and so on and so forth. So we support the fact of having Alzheimer's and dementia-related training. And Representative, to your question previously about what sort of training we receive and ongoing, we have our initial 36 hours that is overseen by the ACL. We have to turn in that, we get their direction from that. So this would be in addition to, I know it has been stated that it would just be within that, but the ACL gives us that direction of what's approved and what's not for those training. And then ongoing, we're required to have no less than 18 hours annually of additional training. So for example, our last quarterly in-person training, we went over the stages of dementia. Everything that we do has to apply to resident rights and making sure that those resident rights are followed and enforced. So our recommendation is listed in here would be the amendment of the language. Excuse me. On that section 3 to strike A through G or to say that it may include. And the reason we ask for that is because there's going to be things that change with the resident and their needs specifically. So there's certain languages in here that we feel is more directed to a provider and a provider of those care needs than it is to our office to advocate for the rights of them. But as I said, we want to be very clear that we do support the training. We're just slightly concerned, as was the ACL, with the precise language that it shall include these certain items, because then it doesn't leave a lot of flexibility for some of the others. So with that, I will be happy to stand for any questions.
Thank you. Leanne and Elizabeth, did you get that? Okay, very good. Thank you. I'll forget in like 2 minutes, so I want to make sure that it's recorded. Committee questions? Seeing none, thank you very much for being here, Haley. Next, we have Linda Mowbray. Linda, welcome to committee.
Thank you, Chairman Carpenter. Committee members, I am Linda Mowbray. I'm with Kansas Healthcare Association and Kansas Center for Assisted Living. And we are here today supporting this bill, not only because we think it's the right thing for the residents in the facilities and for the staff. The price is absolutely right on this. The Alzheimer's Association has excellent training resources and standards. But one of the main reasons that we are supporting this is to the very point that the Ombudsman made. Much of this training is for the provider. If one is advocating for the resident and is acting as a liaison or as a conduit between resident and caregivers, knowing what kind of training that caregiver had is extremely important. The sensitivity that comes with providing dementia care from the provider's point of view is important for the person that's trying to negotiate and to advocate for the resident rights. We believe that the Ombudsman's 36 hours of training is good, solid training, but we feel that incorporating this hour and a half more so that they are able to help see things from not only facts about dementia, but from the side of the provider would be very beneficial in the long run for residents, caregivers, and for the Ombudsman's office. And I'll be happy to stand for questions at the appropriate time.
Committee questions? Representative Bueller.
Thank you, Mr. Chair. And I'm going to apologize up front for maybe being a little slow on the uptake, because I don't know if this is really for Linda or Jamie or Haley. So I was trying to follow and let me ask this question first, Linda. So the ombudsman talked about cutting some of the language or studying the train. Do you agree with that? I maybe should have asked the question of Haley when she was up here, because I don't understand. I think you'd understand that you're in support of the bill as written or as potentially amended by Haley.
Mr. Chairman, if I might.
If that
Thank
made
you.
sense, I'm
Yes,
sorry.
yes, it does.
I'm trying to process.
It does. I was not aware that an amendment language was going to be offered, so my support is for the original language in the bill. The proposed amendment language pretty much negates the ability to enforce the training in this bill. So I'd be concerned that it would give an option, but right now it's an option. This bill would essentially require that this specific training be done.
Okay. And that's what I was after. Thank you, Mr. Chair. Thank you, Linda.
Committee, further questions? Seeing none, thank you, Linda, for being here. Next, we have Elaine Bellardo, private citizen. Elaine, welcome to committee.
Thank you, Chair. Members of the House and Human Services Committee, thank you for your time. My name is Elaine Bellardo, and I'm testifying as a proponent of Senate Bill 88 requiring dementia training for the State Long-Term Care Ombudsman's Office. My experience with the State Long-Term Care Ombudsman's Office occurred in June of 2021. My husband, Rear Admiral retired Jose H. Bellardo III, was diagnosed with early onset Alzheimer's at the age of 50. It was my honor to be his caregiver, and his remarkable character was never touched by the brutality of the disease. As a 100% permanently disabled veteran, my husband was afforded benefits in accordance with his disability rating that provided emergency long-term care placement in my absence. 5 years into the disease, my husband was in the later stages, and so by 2021, he was mostly nonverbal, able to feed himself, but he needed help with all activities of daily living and just navigating the day. In mid-June 2021, my highly active and physically able 86-year-old mother became suddenly ill. And so a Veterans Administration registered nurse and social worker helped plan my husband's long-term care placement with full understanding of his needs as somebody who was in the late stages of Alzheimer's. He was placed for 10 days. I left to tend to my mother, who died 2 days after my arrival. While I was away, I had friends visit every single day. I came back one day early. When I came back on day 9, I returned to find that he was highly agitated, fearful, and had 2 black eyes and a large hematoma on his forehead. When I asked what happened, it was explained that he went to bed perfectly fine and that they found him asleep in the bed the next morning, and he woke up with 2 black eyes. It was further explained that it was an unwitnessed fall, and he must have fallen out of the bed and then put himself back in the bed. I had left written instructions to let them know that he did not know how to get back in bed. He did not know how to put the covers over his head. For him to be found in the bed, asleep and with covers after a fall would require a lot of help. I looked for ways to advocate for him. I spoke with the State Long-Term Care Ombudsman's Office, expecting a response to my concerns that he was assaulted, and I expected advocacy, and I expected investigation. In the end, they created a scenario that my husband did not have the capacity to conduct and labeled the incident an unwitnessed fall that required no investigation. Even after I explained the improbability of the scenario based on how far the disease had progressed and my nightly experience as his caregiver, I was told, "You never know what an Alzheimer's patient will do." Lack of knowledge about late-stage Alzheimer's dementia, stigma, and stereotyping people with dementia left no room for the ombudsman to act on my husband's behalf. For so long, I have wrestled with why such a fine gentleman like my husband had to endure painful mistreatment in a long-term care facility. I am hopeful that sharing the deeply painful experience my beloved husband endured will be a catalyst for change in the state long-term care ombudsman's office. Increasing knowledge, awareness, and understanding of the unique needs of people with a dementia diagnosis in long-term care facilities is my hope for Senate Bill 88. I urge the committee to support SB 88 as written, and I'm prepared for questions.
Very good, Elaine. Thank you for sharing that with us. Did you have committee questions? Representative Bueller.
Yeah, thank you, Mr. Chair. And I just want to make sure I understand. You support the bill as written and not with the proposed amendment, correct?
Not without the proposed amendment.
Okay.
Yes, sir.
Thank you, Elaine. Thank you, Mr. Chair.
Committee further questions? Representative Steens.
Thank you, Mr. Chair. I'm so sorry all that happened with your husband, and thank you for your presentation. I had a quick question with the ombudsman, and maybe this is something that they can answer too, but so when you were saying the ombudsman was not prepared and they didn't understand with your husband's diagnoses, does the ombudsman, when they're coming in and they're facilitating all of that, does state get involved then in those investigations if the facility is not, I guess, sufficient in their own investigation? Is that something the ombudsman does through this, gets the state involved then? I'm just trying to understand.
The order of events for me was that when I came back and I was highly upset that I found him that way, I called the VA and I said, you know, this is the facility that you have approved for him to be in, and this is what happened, and I want to know, how are you going to advocate for him? This veteran should not be treated like this. He shouldn't look like this on my return. And she said, well, there's a state ombudsman's office. You can call them, and they will advocate on his behalf. So I called the state ombudsman's office, and it was just a series of phone calls. They never went. They didn't check the ratio of patients to staff. They didn't go and do any investigation. It was just taken that it was an unwitnessed fall, and there was no further follow-up.
Okay, but your husband wasn't assigned an ombudsman. Like they're not assigned to, you don't have to call them out or whatever. You just called them after this had happened.
I called them after it happened.
Okay, thank you.
Mm-hmm.
Committee further questions? Representative McDonald.
Thank you, Mr. Chair. I just want to really commend you for coming here today and for trusting us and sharing your story. And I think that surely some good will come of this. So thank you so much. I appreciate you.
Thank you.
He's lucky to have you.
He was, and I was lucky to have him. Thank you. All right. Thank
Committee
you.
further questions? Seeing none, thank you, Elaine, again for being here. Next, we have Lori Beck, virtual. Is Lori there? Lori, can you hear us?
Carpenter and members of the committee. My name is Lori Beck, and I'm testifying as a proponent of Senate Bill 88. As a former caregiver for my mom who had Alzheimer's disease and as a volunteer community educator with the Alzheimer's Association, I believe I can speak to the need that would require the Ombudsman staff and volunteers receive training that ensures the health, safety, welfare, and rights of residents living in long-term care facilities such as assisted living and other adult care homes throughout the state of Kansas. As the staff and volunteers with the Long-Term Care Ombudsman's Office investigates and complaints, I think it's vital that they have the skills and knowledge and the ability to determine if the complaint has merit and that they know ways to help residents and their families deal with issues, such as, and this has been mentioned before, knowledge of person-centered dementia, communicating effectively, recognizing those behavioral symptoms, how to address them, address aspects such as safety, wandering, aggressions, confusion, suspicion. As a community educator, I have taught all of these classes to businesses and nonprofit organizations and those simply interested in learning more about Alzheimer's disease and all forms of dementia. I retired more than 10 years ago, 10 years early, so that I could care for Mom in my home, which I did for nearly 5 years before her behaviors changed due to Alzheimer's disease. My sister and I placed Mom in an assisted living memory care facility, and there the staff received training on how to deal with residents with Alzheimer's disease. The staff were very well versed on how to keep the residents calm, engaged, safe, and they treated the residents with the love and respect due our seniors. In my opinion, our long-term care ombudsman staff and volunteers should be equally educated and trained. I urge you to support Senate Bill 88. Thank you for your time.
Very good. Thank you for that. Committee questions? Seeing none, thank you, Lori, for your testimony. Okay, next we have Tiffany. I'm not even going to try to say your last name. But could you pronounce it for us?
It's Nacarado.
Okay, good thing I didn't try then.
Yeah, that's
All
okay.
right.
I know who the telemarketers are too. So
All
it's
right,
okay.
well, welcome to committee.
Thank you. Chair Carpenter and members of the committee. My name is Tiffany Nacarado, Doctor of Nursing Practice and lifelong Kansan, who's proudly served rural Kansas as a nurse practitioner for the last 15 years. I'm here today as a proponent of Senate Bill 88, requiring dementia training for the state long-term care ombudsman's office. As I began my career in medicine, my mother was diagnosed with early onset Alzheimer's disease. She was a mere 56 years old. My father selflessly cared for her at home until his own health began to decline, and ultimately we lost him 3 years ago. You see, one way or another, Alzheimer's disease has robbed me of both of my parents. And as my family navigated the complexities of caregiving, we were faced with the harsh reality of limited resources and support. Ultimately, we made the difficult decision to transition my mother to a long-term care facility, where she's resided for the last 3 years. Despite the challenges, she's now thriving in a safe and supportive environment. As a caregiver and a healthcare professional, I've witnessed firsthand the devastating impact of dementia on families and on communities. That's why I'm passionate about ensuring our long-term care facilities provide the highest quality of care possible. The alarming reality is that over 65% of long-term care residents live with a dementia diagnosis, yet those advocating for their rights and well-being lack proper formal dementia training. You see, this bill isn't about creating new infrastructure or allocating additional funds. It's about doing the right thing. The training exists, and there is no fiscal note attached to this, so by supporting Senate Bill 88, we can raise the bar for care and compassion in our long-term care facilities. As my father used to say, it costs nothing to do the right thing. So I urge you all to do just that and support Senate Bill 88 as written. Let's stand together for my mother, for the tens of thousands of Kansans living with dementia, and for those yet to be diagnosed. Thank you for your time and attention.
Very good, Tiffany. Thank you very much. Committee questions? Representative Apezo.
Thank you, Chair. Thank you for being here. My question is to you. I'm sure you've reviewed the bill in regards to the listing of the available training. In your personal opinion and looking at that, does that seem to be very provider-driven or?
I would say it's a combination of both. But when we're talking about entities that are looking at the intricate nature of how care is provided, that care is dictated by providers. So if you're going to oversee the care that's dictated by providers, you need to be able to understand it from a provider's point of view. That would be like asking me to care for a cancer patient when all I know is what the word cancer means. We have to delve into that more so that we look at it from all standpoints. If these are government-driven institutions that are overseeing care, we have to look at it from a provider's perspective. But I would say it's a combination of both. I'm familiar with the training that the Alzheimer's Association provides because I do community education as well. And I've never once, as a healthcare provider, went, well, gosh, this is awfully provider-centric.
Thank you. Thank you, Mr. Chair.
Committee, further questions? Seeing none, thank you again for being here.
Thank you so much.
Next, we have Ruth Burris. Is she virtual? Oh, okay.
Yes, here I am.
Ruth, are you there?
I'm here. Can you hear me?
We can hear you fine.
Okay. Well, good afternoon, Chairman Carpenter and members of the committee. My name is Ruth Burris, and I am testifying as a proponent of SB 88, requiring dementia training for the State Long-Term Care Ombudsman's Office. I've had several family members who have been diagnosed with early onset Alzheimer's, And one of them, my sister-in-law, is currently in a long-term care facility. She's 58 and has been a resident for the past 2 years. She's still very active and appears healthy, but has no short-term memory and is unable to do things for herself, such as dressing appropriately and taking care of personal hygiene. Sometimes her needs are not met there because she appears to be very capable. Alzheimer's can often be misunderstood if there's no training regarding how to deal with the unique challenges presented by an Alzheimer's or dementia diagnosis. Additional dementia-specific training regarding Alzheimer's and other dementias for the State Long-Term Care Ombudsman's Office would help with the understanding of the challenges that Alzheimer's and other dementias present. There are specific challenges and communication needs regarding those with dementia, and understanding those needs is crucial to be able to effectively advocate for their rights and to address concerns relating to their care. I urge the committee to support SB 88 as the bill is written. If you have additional questions, I will stand for them at the appropriate time. Thank you.
Very good. Thank you, Ruth. Committee questions? Seeing none, thank you very much for testimony. Okay, committee, I'll bring your attention to the written-only proponent testimony from Kylie Childs, Janet Hayes, Linda Wyatt, Daniel Goodman, David Herdman, and Valerie Johnson. With that, we will close the hearing on Senate Bill 88, and we will open the hearing on Senate Bill 193. And with that, we'll have an overview from Carly. Carly, you're getting kind of a workout today, aren't you?
Just wait till Wednesday. Thank you, committee. Sub for Senate Bill 193 provides an exception for law enforcement agencies from participation in the state opioid antagonist protocol. This bill is very similar to House Bill 2159, which we've heard. Senate Bill 193 amends KSA 6516-127 to include an exception in subsection F, adding that a law enforcement agency could be exempt from subsection F unless such law enforcement agency elects to provide an emergency opioid antagonist pursuant to the protocol in subsection B. That's the same amendment that we added to House Bill the committee added to House Bill 2159. The bill passed the Senate by the vote of 40-0, and it would go into effect on July 1st, 2025 upon publication in the statute book.
Very good, Carly. Thank you for that. Committee questions of Carly. Very good. Thank you. Next, we have patiently sitting there waiting to testify for the second time on the exact same bill or close to the same bill, Ed Klump. Thank you, Ed.
Thank you, Mr. Chairman. Committee members, I think we can make this pretty brief. As Carly said, this is the same identical provisions as found in subsection B of House Bill 2159. The difference is Senate Bill 193 does not have the grant program in it. Real quickly, what you see in 193 and the amendment that you made to House Bill 2159 in Section 2 were both at our request, and so they were identical in that request. I'll just remind you why this is important to us. We have small agencies that have difficulty finding a doctor that is willing to take on the physician advisor for these programs, and that keeps them from obtaining and utilizing and issuing the naloxone or Narcan without that under this current statute. So what this amendment does, it only exempts us from requiring that physician advisor if we are getting our drugs in a non-prescription form. If we do end up having to get them from a prescription form, again, it leaves everything in place, including the requirement that we would have to have the medical advisor again. So when we started all this, it was a prescription drug only, and that's why we had to have a medical advisor in the statute to authorize the prescriptions for us. And now, since it's been made an over-the-counter drug, we don't need that anymore from our perspective. I'll remind you that I talked to EMS, I talked to fire. They didn't have a problem with this because they have to have medical advisors for other purposes, so it didn't affect them. So with that, Mr. Chairman, I think that pretty well sums it up.
Thank you, Ed. Committee questions. Representative Weichel.
Thank you, Mr. Chairman. And I'm honestly not sure if this question is best directed at Mr. Klump or the reviser, but when I was looking at these over the weekend, to me, it reads like there's different definitions when you look at the definition of first responder agency between 2159 and 193, and I just didn't know if that was relevant. I'm looking at line 23 of 193 and page 2, line 15 of 2159.
That could be an amendment that we didn't get made when we modified 2159. So I'll let the reviser answer that. They're looking at it now, I see. Because I think we had to, the original way we planned on doing this, I think it required some changes in that. So it could be we just didn't get them changed back. We'll see here. I didn't bring my copy of the other bill, so.
Thank you, Mr. Chair. This is Jenna Moyer, Reviser of Statutes Office, and it does look like those are different. If I recall correctly, when we did Senate Bill 193, I was instructed to essentially get rid of all of the markup initially done and then just add in that exception relating to F3 about it being exempt. And so I don't know if that's a technical thing that we need to change in House Bill 2159, or if that definition can stay. I'll let Ed can probably talk more about that.
Yeah, we'll take a look at that here in just a little bit.
Actually, I think it's fine the way it is in 193 because that's back to the original language of that definition in the current statute. So I think 193 is correct. And I think if you move 2159 forward, you probably need to delete the strikeouts in line 16 on page 2 to get it back to the original language. Is that correct?
Jen, is that, or Carly, is that going to be, okay.
Okay.
Very good.
Okay.
Any further questions of Ed? Representative Turner.
Thank you, Mr. Chair. As you mentioned, one of these has a grant program in it and the other one doesn't. Could you remind me on the grant program and why that would be different in the two bills? Thanks.
Well, the grant program was initiated by a representative, and we supported that. I will tell you, we do still have agencies that there's not enough grant money to go around right now to cover all these requests from first responder agencies and the public now as well. And I did some checking, and we do have agencies that are having to buy that out of their budget yet. So we supported that. We also understand the challenge of putting new costs in the budget, and so we certainly would welcome the assistance with that. But we did this bill without that because we didn't have the information on what was going on in the House at that time.
Okay, so the base bill just talks about law enforcement access via prescription or non, and then the grant money would actually be to pay because you're saying that comes out of law enforcement money.
Right. So in 2159, subsection 1 was about the grant program, and it was to provide some additional funding solely for first responders to purchase the Narcan.
Thank you, Mr. Chairman.
Committee, further questions? Seeing none.
Representative Weichel, thank you for bringing that other to our attention.
Thank you, Mr. Chairman. On 259, you don't have the bill, do you? Here it is. Section 11, number 11 through 33. Are we going to strike that? The $4 million?
We're actually hearing Senate Bill 193 right now, so we're going to work
In the future, yes.
259 here right after this, so you might be surprised what happens.
You never know. That's good. hopefully the two, representative is right. The two wordings are a little bit different. A little bit. Thank you, Mr. Chairman.
Thank you, Representative. Committee, further questions? Seeing none. Thank you, Ed.
Thank you.
I'm going to go ahead and close the hearing on Senate Bill 193. We'll begin working House Bill 2159. Are there any amendments? Representative Howell. For the bill. Do you have a motion to work 2159? I'll make a motion. Do I have a second? Second by Representative Rivas. Okay, now, are there any amendments? Discussion on the bill, I guess, first. Seeing none, are there any amendments on the bill? Oh, discussion. Representative McDonald.
Thank you, Mr. Chair. Would it be possible for Mr. Klemp to explain to you what he was just trying to explain to me? It's about a needed strike, I think, that he found. He's going to be better at it than I am.
Okay, Ed.
Thank you.
I know that's a little irregular, so it looks to me like we're okay with that because that definition is on page 2, lines 10 through 11, where it was restored in the amendments you made to 2159. So I'll let the revisor verify that, but it looks to me like it is included here. That definition was put in because we were separating law enforcement from the other first responders. I think it's put back together right, but better left to the revisor. Thank you, Mr. Chairman.
Very good. Thank you, Ed. I think we'll get it worked out. Okay, we have a motion and a second, so the bill is before us. Are there any amendments? Representative Howell.
Thank you, Chair. I do have an amendment. Should I wait to have it passed out before I explain?
Do I have a second on the amendment? Representative Steens. Okay, Representative, would you care to explain your amendment?
Absolutely. Thank you, Chair. So essentially, this strikes Section 1 and renumbers the sections accordingly as it explains. It's pretty self-explanatory, and basically, I believe it essentially makes it mirror Senate Bill 193. Is that, yes, make sure I was remembering the bill number correctly.
Committee discussion on the amendment. Representative Ruiz.
Thank you, Mr. Chair. So the amendment is striking the grant fund. Is that correct?
That is correct. Yes, ma'am.
Can I ask why?
I have a number of concerns, even though obviously I think all of us in the committee support the purpose of the grant. I have a number of concerns of doing that from this committee and how the funding's handled. As you yourself pointed out, when we heard this bill in the first place, we already have funding set up through DECA and all those things. So I think addressing funding at a later time and a later format might be more appropriate than right now and in this bill.
Thank you, Representative. I just want to make a comment. I know when I raised the issue about it was a $4 million that was going to put in there, and then it was reduced to $500,000, which was much more reasonable. So, all right, thank you.
Any further discussion on the amendment? Seeing none, you may close on your amendment.
I close on my amendment. Thank you.
Okay, so committee, all in favor, say aye.
Aye.
Opposed, same sign. No. Would you like your vote recorded?
Yes.
Okay. So we have one no. Okay, everybody that's a no, raise their hand. McDonald, Orpeza, Ruiz. Casey.
Meyer?
Yeah, I wasn't going to do that. And Weichel. So, all right, very good. So what do we want to do on this amendment? On the stricken language? Committee, I would like to offer an amendment. The stricken language on page 2, line 16 should be restored. Okay, and Carly can explain that. And I need a second. Second by Representative Rivas.
Thank you, committee. On page 2, line 16, before fire, it would insert law enforcement agency, and then also in line 16, before of, would insert of or criminal forensic laboratory, and that would make it consistent with 193.
Committee discussion. Seeing none, all in favor say aye. Aye. Opposed, same sign. Motion carries. Amendment is received. Okay. Do I have a motion to move the bill out of committee? Representative Bueller, second. Second by Representative Steens. Committee discussion. Seeing none, all in favor say aye. Aye. Opposed, same sign.
No.
All right. Raise your hand if you want your no vote recorded. Orpeza, Ruiz. Hobson. Okay. Thank you, committee. Bill is passed. Thank you for your quick work today. I will tell you, if you've looked at the agenda, it's going to be a busy week. I fully intend on getting about everything we need to get out of this committee this week. We may have some carryover next week, but we all know we're up against a timeline. I will say that be ready because there may be final action on bills the same day. So be ready with your amendments or anything that you have on these bills. Be ready for them because there are several bills, a lot of bills that probably are not going to be very controversial or anything like that, that we will just knock out. We'll hear them, and then we'll work them the same day. But if there are folks that have amendments ready, just be getting those amendments ready for any of those bills that you may need. So I just want to give you forewarning that we're on a mission this week to get things done. So with that,